So maybe a first question would be, give us a state of just your tribes. Madison has just been designated in December, Truax Field, as the home of F35A. Doctor, can you start? Give us an overview.
Ron Martin is president of the state's largest teachers union, the Wisconsin Education Association Council. On November 13, he and WEAC's executive director wrote Andrea Palm, state secretary of the Department of Health Services, asking for a statewide standard that would determine when our K-12 schools would be open in person for in-person learning or online. So it's a great time for Ron Martin to join WisconsinEye for a Newsmakers. Ron, welcome back to WisconsinEye.
Thanks. It's good to be back, Steve.
Ron, I do want to get to your request, your November 3rd letter, asking for a statewide standard, because that's the purpose of this interview. But just yesterday, Assembly Republicans came out with a COVID-19 package, and I want to ask you about two specific proposals of Assembly Republicans. And let's be sure, Senate Republicans have not signed off on these, and they probably won't pass muster with Governor Evers. But when Assembly Republicans want all K-12 teachers to teach from those schools by the end of January, point one, and point two, local school boards would have to have a 2/3 vote to offer online instruction. As president of the largest teachers union, what's your response, sir?
You know, I just think that those and many of the other provisions that were introduced by the caucus leadership, it really, flies in the face of true democracy, as well as being able to deal with the true problem at hand. You know, the 2/3 local school board vote, that's simply taking the control out of a duly elected body. I'm not so sure that Representative Voss would appreciate our federal government coming in and saying any law that's passed in Wisconsin has to receive, 2/3 of the vote of the legislature. I don't think he'd appreciate that, because it's, he's a duly elected individual, and I don't think that we should be doing that for our local school boards either. And I think that that's simply overstepping the bounds of the legislature and not democracy.
Quick follow-up, Ron. What is the number one thing that Assembly Republicans could do to help our K-12 schools, teachers, faculty, staffers, students fight COVID-19, if not that package they announced yesterday?
Right. I think they simply have to provide additional resources so that we can provide the things that are needed so that we can keep our staff and students safe, like PPE. It's costing school districts a lot of money to be able to provide those kinds of gowns and masks, et cetera, as well as more resources for hiring additional staff so that we can get class sizes down, particularly for those school districts that are face-to-face. So I guess simply put, Steve, additional resources would have been nice for our public schools.
Before we get into the guts of your letter, which I found fascinating, let me ask you this overview question. Don't Wisconsin school children learn better in person?
Absolutely. And I don't think there would be a teacher that would disagree with you, Steve. We absolutely want to be face to face with our students. There isn't a teacher that I've talked to that doesn't wish they could be in the classroom 100% of the time, face to face with their students. But we're in a pandemic. We're in a crisis. We're in a situation where we have a deadly virus that is wreaking havoc not only on our state, but this country. And until we get control of that, we can't have business as usual. We can't do what we've always done before. And I'll tell you, Steve, we're ready. When this pandemic is over, we're ready to put in the extra time, extra resources, and what's needed to be able to get these students caught up, to get them, back to where they need to be.
Okay, now I want to quote from that letter. Ron, you say school districts across Wisconsin are caving to community pressure to remain open rather than basing those decisions on science. You use the example of Kenosha, Oconomowoc, Middleton, Cross Plains. Number one, talk to me about what happened in each of those three communities and why that's the wrong way to go.
Well, I think what happened there was the school boards in all three situations, they first looked at what the science said. They worked with their local health departments. And that's been our stance since day one, since March. when this all broke and we had to close down our schools, and then there had to be a decision, how are we going to restart or reopen our schools in the fall, that it has to be a locally controlled decision, meaning each school board with administration needs to make that decision, and it needs to be based on science. They need to work closely with their health departments. And in all three situations, that's what they did. I can speak most specifically to Kenosha. I mean, their first vote was to go virtual because they had worked with their local county health department. They looked at their numbers and they said, we can't open face to face. We need to go virtually. Well, there was an effort by a group of parents to organize against that and to put a lot of pressure on the school board to reverse that decision. And that happened, in all three of those school districts. Well, I get that it's hard and it's challenging for parents, but the number one concern a school board must take is the health and safety of its students and its staff. And when they cave to a parental pressure because it's not convenient for them, that's not the way a school board should operate. And we're putting a lot of people at risk.
Well, you said that school districts in an ideal world should rely on advice from local health departments. But your letter quotes one specific county health officer in Pepin County as saying, I'm not going to offer any advice. So how consistent or lack of consistent is the advice from local health departments statewide, Ron?
And that's really the purpose for the letter. I mean, we were really counting on local health departments and school districts to work collaboratively to come up with requirements that would be based on science to be able to determine if the school should be open, face-to-face instruction, or if it should be virtual or some sort of hybrid in between. We were really counting on that. And what we are finding out from our members, that there's kind of the Wild West going on out there. There's a lot of pressure from local elected officials to force health departments to say, no, don't be making gating requirements. Don't be making this, too strict. And, kids don't get the virus like adults do. So the safest place for anybody to be is at the school. And so we realize it's a hit and miss out there. It's the Wild West. And, I think I identified, in one county, right next door, they have really good gating requirements and they have a criteria set up, and then right next door, no criteria. And so we're real concerned about that because we know this virus doesn't stay within boundaries, doesn't stay within walls. It travels everywhere.
Well, you also in your letter, Ron, you say Wisconsin is number 5 in the nation in terms of COVID in children. So this is a very real situation that every parent wakes up every day worrying about, correct?
Absolutely. And when I think about this I remember a few years back, several years back, the Bloomer Middle School was closed down because of a mold problem. They had black mold growing up and down the wall and they closed it down. And I thought, what's the difference? A deadly mold like that. It's because they could see the mold. They can't see COVID. COVID's inside of us. And, that's the huge difference. We'll close down when we can see it, but when we can't, we won't. And I think that's real dangerous.
Well, if there's no advice coming from a local health department, then your letter points out that different school boards have set different standards. You referred to the North Shore School District. Mm-hmm. They would go online if there were 350 positives per 100,000 residents. Walworth County, though, a different standard. But talk to me about Racine. Racine Health Department wanted to make all their schools go, public and private schools, go online. And the Supreme Court last week issued an order saying you can't do that. So what does that tell you about the varying local situations?
Well, that's a prime example right there. I mean, what you've just brought up about Racine. And the other mitigating factor with the Racine situation is Racine has a large number of schools that were built in the 1940s, 1950s. They don't even have proper ventilation, and they're not given the additional resources. They don't have extra resources to be able to get their class sizes down. So not only that, but then you look at what the science is saying from the Racine County Health Department. they're making the right decision by saying they should be virtual until we can get some sort of vaccine or we can get some sort of control. And by doing that, they've allowed the educators there to be able to plan out and prepare lessons. While it might not be face-to-face instruction, they're still going to get good instruction from highly qualified educators. It's just going to be done in a different way.
You and I have seen the sad numbers on the achievement gap in Wisconsin. How has the pandemic, how will it contribute to the achievement gap in Wisconsin between white students and students of color?
Absolutely. And we've had this problem for a significant number of years, and it's only gotten worse, particularly for our Black students in the state of Wisconsin. This pandemic will obviously wreak havoc on the achievement gap. It's going to widen that, but I think we're going to all see a drop in achievement with our students during this time period. And we're going to have to then do whatever we can when we're able to be back in face-to-face instruction, offering all kinds of resources to be able to get our kids back to where they need to be. And then we have to pay special attention to our students of color, making sure that we're offering resources. And that's really what our legislature should be doing. They should be looking at the kinds of resources that they could provide for school districts so that they could offer after school additional time for students and families, other resources with community engagements or connections like the local public library or the Boys and Girls Club. Those are the kinds of things that they should be addressing, not punitive things that hurt our schools.
Your letter says that school districts have used different standards. You refer specifically to school districts that have set a specific number of positives per 100,000. Then you refer to districts like Franklin, which say we'll shut down if we cannot contact trace within 24 or 36 hours. And then finally, you talk about districts that have adopted standards. If we have X percentage of students and faculty out with COVID, then we'll go online. What standard is WEAC asking for?
Well, in the letter, we identify and we ask that the Department of Health Services look at the national standard. And Steve, off the top of my head, it's failing me. It's the Harvard.
Yes.
The Harvard.
Anyway, you refer in your letter to a case incident. In other words, X number of positives per 100,000.
Right. And then also to be able to look at some other mitigating factors like the Shorewood School District has identified within their criteria in determining if they should be able to open. So not only looking at the incidence rates of COVID, but also some other factors like the hospital bed utilization and all those other sorts of things that the health department are experts on. I'd like to say that I know a little bit about this, but I really don't when it comes to the actual science. And I have to rely on the people who are scientists, who are doctors, and they have to be able to be the ones to tell us what it should be. I can tell you how to educate a child and the needs of a child and how we do instruction, but we have to let the experts be able to give us guidance and direction. And that's really the meat of what this letter is saying, is that the DHS really needs to set that gating requirement to help local school districts and local county health departments be able to make the decision based on, real strong evidence from the DHS.
You're hearing from your members statewide. Is there one school district you want to call out for doing basically everything right? I mean, is there one school district that occurs to you that is really on top of it?
There are several, I'm sure, and I hate to call out any one in particular. I know my own school district, the Eau Claire Area School District, and working with many of my friends who teach there, my colleagues, they've done some right things there, and working with the parents, the community, being able to determine what's best, being able to make sure that their class sizes are smaller so that they can keep the social distancing, mandating, requiring students wear masks unless they have a medical authorization that does not or that prohibits them from wearing a mask. Those are all really important things. But then being able to offer to the parents the choice to be able to have their child go virtual because the parents are fearful, and being able to make sure that that's set up in a really good way and a way in which the child feels connected to the class, to the teacher. And so, and then also the Eau Claire Area School District, I know they've given the educators there some flexibility to be able to, spend some time working with students in different ways, less department meetings, less grade level meetings, and more time with families and kids. And again, there are so many good things going on in the state right now when it comes to what administrations and school boards have decided, but we have to make sure that this is consistent throughout the state. The only way we're going to get control of COVID is we have to make sure that we all have guidelines that we follow.
You're hearing from teachers, your members across the state. What's their biggest fear? How afraid are they if they have to go back to an in-person learning environment?
Well, number one, they're afraid that they might be a carrier and bring it to one of their family members. And they'd be just devastated if they were the ones to bring COVID to their home that might take the life of their spouse or their parent or even one of their own children. So they're really fearful of that. They're very scared of that. I think many of the educators are concerned overall for the health of all students as well. We don't know. There's so much unknown about COVID. And so they're so fearful that they've got all these students gathered in a classroom and, they just don't know what this disease will do, what this virus will do, or how it affects children. There's still so much unknown out there that they're worried about the long-term effects.
I'm sorry to have to ask this, but how many WEAC members have died of COVID-19?
To my knowledge, right now we have, I believe, 5 educators that have passed away, but we've had several of our members contact us that a family member has passed away. I can't give you that number, but I do know we had early on 2 support staff individuals pass away in Milwaukee, and then most recently, I think it's been 3 educators, a Milwaukee educator, Howard Suamico, and then I believe 1 more.
Okay. Who should adopt this standard? You wrote your letter to Health Services Secretary Andrea Palm. Does DHF have do your lawyers say DHS has the authority to do this? Can DPI do this based on recommendations from DHS? Or would it take another governor's declaration of emergency to do this?
My understanding from the attorneys that I work with at WEAC is that the DHS has the authority to be able to mandate that local health departments use these gating requirements or use the gating requirements that are established by the DHS, that they have the authority to do that. The decision still lies with the local health department and the school district based on all the other factors, but the DHS does have the authority.
Well, Governor Evers, of course, former superintendent of public instruction. Now, I've covered his press conference. He said repeatedly, this is a local school district by school district decision. By WEAC asking for a statewide standard, are you going against the governor saying it should be done on a school board by school board basis?
We're actually trying to help the school boards. We're trying to help the school boards and the administrators with a consistent gating requirement for all. Right now, it isn't consistent, and it's proving to be a wild west out there. So I don't believe we're going against the local control, other than here's the standard, you have to apply it. Now you need to determine what's best and how you offer instruction. Is it a hybrid, or is it face-to-face, or is it virtual? And is it based on the gating requirements that have been established by the DHS?
Well, you and I are following eagerly and anxiously the debate over vaccines. Here's my question. Now, the priority for vaccines, healthcare workers, then older Americans in nursing homes, long-term care facilities, then people over 65. Where should Wisconsin know? Where should teachers nationally rank in the line, in the priorities to get the vaccines?
I absolutely think that if we're going to continue to have face-to-face instruction We have to have our educators up near the top. They have to be up near our healthcare workers, our essential workers, fire, police. They need to be moved into that category when it comes to the vaccine. And I do realize that there's going to be a limited amount of vaccine out there. And so if we can't get it to the educators in that top tier, we have to be in the next tier, at the top of that next tier. So healthcare workers, essential workers, the elderly, over 65, and those with, medical situations or circumstances. And then that next tier, I think educators have to be at the top.
Tragically, this week, a 16-year-old Madison East High School student died. What message does that tell state policymakers and legislators about where we stand vis-a-vis the pandemic, sir?
That the virus does not discriminate based on age. For so long, we've heard it really just attacks people who are a little bit older, who have special medical conditions or situations. It really does affect teenagers and young people as well.
We're coming up, Ron, on the 10th year anniversary of Act 10. Talk to me about the impact of Act 10 on Wisconsin's teachers, or your members.
Absolutely, Stephen. You know what? I think that our superintendents and our school boards can answer this better than anyone. And why I say that is they're all talking about this teacher shortage in Wisconsin. They're all talking about there's not enough teachers to fill all the positions, and we don't have enough students in the pipeline in the teacher prep programs to fill all what could be the vacancies in the next 3-4 years. So let's rewind a little bit and let's take a look at what causes or what are some of the factors for people not wanting to go into the teaching profession. The lack of respect for educators. And that's really what Act 10 did. It took teachers away from the table, the decision making. It didn't allow for teachers to be able to have a voice in their workplace. It didn't allow for teachers to have just cause, so that if they spoke up against something that was being done in their district, they could be punished or penalized. The morale within our teaching profession has been at the lowest that I've ever seen it. And this is pre-pandemic, pre-COVID. Can't imagine it now. It's got to be even worse. And, when they took the ability for us to be able to talk with management about our salary, and they took away salary schedules, and they took away voice, it just created an environment where who wants to be a teacher now? And that's really the ultimate impact of Act 10.
Okay, but you and I have heard Republican legislators and candidates and former Governor Scott Walker saying that Act 10 saved Wisconsin residents more than $5 billion. Money they didn't have to pay. Your response?
My response is first of all, I'd like to actually see the real proof of that, where those savings really are, because, they were the one-time savings that aren't a continual savings for districts. So I'd like to really see the proof in that. But secondly is unintended consequences. The unintended consequences of not being able to have a teacher workforce, and is going to be detrimental to the future of public education in Wisconsin. And that can't be measured in dollars or numbers. It's going to be measured in being able to attract and retain quality educators.
Has WEAC lost more than half its members over the last 10 years? 2/3 of its members? What percentage?
Yeah, that question has not been asked in so long, Steve. We're on the rise. Every year we're growing in membership. So I think right away, initially when Act 10 hit, we got hit pretty hard, and it was 50%. But we're now slowly on the rise of gaining back our numbers. We just got done with the recertification vote, which doesn't determine if you're a union. It just determines if you have the right to bargain with the school board and administration over base wage. And 98% of the locals that participated in the recertification successfully passed that. And so we're on the rise. We're continually growing, getting new members. Our largest membership growth has been our new teachers. And so they really believe in the union. They believe in what we can do and the power of solidarity. And it's been really kind of enlightening from me as an older teacher.
Well, the combination of the pandemic forcing many teachers to go online. Some of them may not be as effective an online teacher as others. So have we seen a lot of retirements, both because of the pandemic and Act 10 in the last years?
Absolutely. I mean, Act 10, we saw a record number of retirements in the years that followed Act 10, the most immediate years. We saw a large number of individuals. I mean, I think they were fearful of their retirement. They were fearful of what they've contributed and what was put aside in the WRS for them. They were fearful. They did not want to lose any of that. But also the incredible increase in insurance and the benefits that were negotiated or bargained for early retirement. Individuals saw that those were going to be eliminated. And so they said, I've got to take this opportunity now because, I worked for 30 years and I've been not getting a pay increase because I wanted that early retirement benefit. Yeah. And I've got to retire now. Otherwise, I'm not going to get that. We also saw a large number of individuals submit retirements for this year, not only during the school year, but we know that they're going to submit for the end of this school year as well, that this COVID has really taken a toll on them. But we also saw a record number of younger teachers resign mid-year this year.
Why? Because of the transition to online?
Because of the COVID, being forced to go back to school, face-to-face instruction, they were fearful of being able to bring it home to their children. And they thought, and several of the teachers that I talked to a young teacher from Freedom. She did not resign, thank God. She's real young. She has small children. And she said, I don't have to work. My husband has a good job. We've got insurance through his work. So I'm really thinking I'm just going to resign. I don't want my children. I don't want to bring this home to my family. And so, I mean, that's kind of the sentiment out there was, geez, if I don't have to work, why? And they resigned. A young teacher in Spooner, a special ed teacher, because in Spooner School District, the administration is still refusing to require the students to wear masks. She resigned. She took the penalty. She paid the fee. She says, I'm not going to put my family at risk. And she resigned, a young special ed teacher. And I thought, oh my goodness, we can't lose good teachers like that.
Two final questions. How has WEAC and DPI, what new efforts have WEAC and DPI launched to help our existing teachers be more effective online?
We meet every Monday with the Department of Public Instruction, as well as the School Boards Association, the District Administrators Association, several other associations. And we've addressed some of that, but we haven't really collaborated together on that particular issue. But we as an organization have developed PD Wednesdays, or so today we have a professional development opportunity for educators, and all of that is centered on how to be successful in this environment, how to be successful in online instruction, and how to meet the needs of students. Different things to do to help keep your sanity, self-care. But we also launched for parents. Open to any parent in the state of Wisconsin, how to navigate through this really tough time of online learning. And I will tell you, we get a large number of people who sign up for those virtual seminars.
Okay, last question. When a group of young, talented people, or maybe just one of them, comes up to you and says, you're president of WEAC, why should I become a teacher in Wisconsin in light of the pandemic, in light of the Act 10 legacy? What's your elevator speech in response?
Oh, Steve, that's a really great question. And I think about that often. But one of the most important things is we need really good educators. Teaching isn't a job. Teaching is a calling. And we need individuals who have been called to teach. And we need you. When talking to young people, or a young person comes up to me, and that's what your union is all about. We're there to help you be the most successful that you can be as a classroom teacher. We're there to support you, provide you guidance, give you direction, mentorship. We want you to be successful because every single kid in the state of Wisconsin deserves a great public education with a great teacher.
Ron Martin, president of the Wisconsin Education Association Council. Thanks so much for nothing more important than the future of our children. Ron, thank you.
Yes, thanks, Steve.
Take care. Be safe.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.